There has been so much of confusion regarding PSA or prostate specific antigen. And for a common man, any abnormal report obviously brings about a panic. His clinical situation will not bring about that panic because he would adjust gradually to changes which happen around. It could be obstruction to a flow of urine gradually over years. And when you ask him a question, he says, yes, I'm an old man and my flow is poor. But when you tell him a PSA report is abnormal, beyond the normal range, he panics. In today's world, PSA or a prostate specific antigen needs to be decoded. For a common man on the street, a PSA rise almost is like looking at a prostate cancer, and he therefore panics. PSA or a prostate specific antigen is an enzyme produced within the prostate. So it's produced within the prostate and can be measured because it spills over into the blood. And the blood measurement gives us a parameter about what we need to know. So prostate specific antigen or a PSA is an organ specific marker. It's not a cancer marker. It's an organ specific marker which actually could rise in some situations. Its rise can be in very acute setups. It could be in a progressive setup or in a chronic setup. And that's why we have never decoded that. We have actually been reading about it and understanding that any rise in PSA, we need to panic around. Not necessarily. It depends on in what kind of clinical situation did the PSA rise. For example, you went for a health checkup. In a health checkup in a man from 50s to 70s, without any urinary complaints, without really no urinary complaints, which could be interviewed and interrogated and brought out from you. That means you went in there for just an evaluation for your health checkup and you find that the PSA level is abnormally high. The normal levels of PSA beyond 50s are looked as 0 to 4 nanogram per set. For men less than 49 years, it's thought about that the PSA 0 to 2.5 is normal. But very abnormal PSA range can always be changed and looked at the causes around. Not necessarily that all the time there will be causes which could be bothersome. But yes, PSA is a very great marker of an ambiguity or an abnormality of the prostate changes which happen internally. It's the production of that as an enzyme within the prostate spilling into the blood is what is measured. And that measurement could be haywire in under situations. For example, as I was quoting, a man in his 50s to 70s goes for a health checkup without really any urinary complaints and finds that his PSA is abnormal. What does he do? He sees a urologist. So in this city and in this country, if you have a urology friend or a doctor whom you know who does urology, he would evaluate it. He will look at that report, but he would also ask you questions, and the questions will be pertaining to your urinary complaints. And the urinary complaints could be anything. Your obstruction to the flow of urine, your bothersomeness in urine, which possibly you have bypassed and adjusted gracefully as you age, or there could be complaints in terms of picking up something and then probably corroborating it. So when an examination happens of yours by a urologist called digital rectal examination, the fingers or the tip of his index finger is trained to evaluate the prostate by a digital rectal examination. He can feel, palpate, and know everything about the prostate, an approximate size, the kind of the feeling, the kind of homogeneity, the kind of induration, all those kinds of abnormalities that he can pick up. He probably encompasses that to your PSA level, which actually has been a reverse way. So PSA level came first because it was a health checkup and it was raised. And an examination by a urologist, almost for sure, gives you a lead or insight into what next. And therefore, if there's something abnormal, he would ask for an MRI for prostate doing a period scoring. He would ask for a transrectal ultrasound, or he would ask for further evaluation. On the day of evaluation, almost necessary, he will ask you for a uroflowmetry, which we do regularly out here for men beyond 50s who have got lower urinary tract symptoms alerts. And they pick up a lot of things which give us an idea that PSA is another marker which has gone wrong somewhere, and how do we correlate that? So that was for all individuals who have gone for a health checkup, and the health checkup has shown an abnormal PSA. Need not panic. But yes, if there are no complaints at all, number one, and if there's nothing which actually brings to light in terms of a discomfort and something which was never there in urinary complaint, that means you are in a very cold situation. And then we evaluate your PSA and the PSA levels are high. That means there's a reason for us to understand that why is the PSA high? So why is the PSA raised at all in blood? The commonest reason possibly could be prostatitis. It could even happen in 40s, 50s, 60s, 70s, 80s. In other words, a younger man also could have an acute severe prostatitis, and wrongly at that point in time, if you have checked the PSA level, it could be very high. That's a hot situation. I said, you were in a health checkup and you had a very cold situation, you have no complaint, and we need a PSA. And if that PSA is raised, then it may not be alarming, but then that's the time a urologist would actually find his way out through this jungle and identify the cause of it. That's where we go all the way down to possibly a transrectal ultrasound, an MRI to look at the Perad score, maybe a prostate biopsy if there's anything abnormal, to prove and disprove that the reports which we have picked up in the health checkup are possibly not alarming or not worrisome. But as I quoted that, even young men with acute severe urinary tract infection called prostatitis, which could be an acute prostatitis related to a urinary obstruction related infection, or maybe a sexually transmitted infection, which actually makes it home within the prostate, gives all those discomforts in the urinary tract. Now he's in a hot situation. He has got discomfort while passing urine. He has got burning sensation while passing urine. He has got pain. He's got fever. He's not able to pass urine at all, which was all good few days to a few weeks ago. So an infection brewing up can give you that kind of a trouble. If that is happening, then possibly we're dealing with an acute prostatitis in a young or a middle-aged or an elderly man. That kind of an acute severe symptom of bleeding, pain, fever, burning, discomfort, all which was never there and suddenly came up, is possibly something need to be looked into in details. At the same time, get into hugely supportive symptomatic therapy, getting him cured of his prostatitis. And if that has been done, you'll find that that PSA, which was wrongly done at that point in time, and which was alarmingly high, gradually comes down. So that's where the crux of the matter is. If a PSA is raised in an acute setup or in a setup of a lower urinary tract symptoms in a male in 40s to 90s, then we would look at the PSA as a surrogate marker and we look at the clinical situation. We would treat his clinical situation, but give an antibiotic for an appropriate period of time, and then we look at the PSA again. And lo and behold, you're actually amazed that the PSA came down dramatically down. Dramatically down. So people come to this clinic at the Coquelin Hospital in the urology department every day, every week with a panic about a PSA raised either in a cold setup like a health checkup or a PSA which has been possibly wrongly done at a point in time and it's not to be done. That means you have an acute dysuria, burning sensation, fever, urethritis, urinary complaints, or prostatitis. And in prostatitis, the PSA will be remarkably raised. So from 0 to 4 nanogram percent, which could be normal for people across, it could be anything between 10, 20, 40, and even 100. The patient is having fever, chills, getting admitted. That's not the point. We will actually do a PSA level. But if it has been done, you will find that how a prostate responds to any kind of inflammation. And that inflammation infection has raised the PSA dramatically with the amount of production spilled into the blood. And that can only resolve with time. The time is a great healer. You're on antibiotics for 2 to 3 weeks. Your PSA is repeated. It gives us a huge lead about the way the PSA plummets down to its nadir level. So normally we do a PSA between 10 to 14 to 21 days, depending on how it goes. And we may probably serially do for a while and look at when this PSA is going down. Somebody PSA is not going down dramatically in the background of whatever clinical activity. Needs to be looked into with a little bit of suspicion around. Friends, PSA can rise in retention of urine. PSA can rise even after a catheterization kind of thing around. PSA rises commonly in very chronic setups like the chronic prostatitis. Many of our youngsters are labeled as chronic prostatitis, inflammation, discomfort in the perineum, burning sensation, passing urine, but not that force which should be of a young man. And in that 40s, 50s, 60s, many people suffer from this disease called prostatitis, chronic prostatitis. The PSA levels are marginally borderline raised and even higher, and people live with it. Many times to actually come to the base of it, we do a prostate biopsy. A TRUS-guided prostate biopsy or a transrectal prostate biopsy is done under local anesthesia. And frankly, it's painless. It's done with very fine needle, and there are the saturation or core biopsies which they do around. They actually would look at the entire area as locally anesthetized. The biopsy is always covered in an antibiotic cover because we're doing it through a rectum, and rectum is obviously possibly contaminated. Doing so and spilling it into the urinary passage can lead to somebody, if not everybody, to a sepsis. And therefore, to take that kind of precautionary measure, we actually look at covering it with injectable antibiotics and then following up with an oral antibiotic and looking at anybody. It could be 1 in 1,000 or 1 in million who develops a UTI, who develops anything like fever, chills, probably gets an injectable antibiotic course so that it doesn't go down the hill as a sepsis or a urosepsis induced by an investigation. So this investigation is probably a hallmark or a benchmark of diagnosing you, whether it's prostatitis related raise in the PSA or the PSA has gone up because of a malignancy of the prostate. In September, the Prostate Cancer Awareness Month, the awareness that we have actually been spreading to men from their 40s, 50s to 80s is all about being aware of the urinary health. If the urinary health is not in shape, which is about the lower urinary tract, because the kidneys are out of your governance. They work and they attempt to do all that for you while in your wake and sleep hours, and you have no correct control and jurisdiction over it. So kidney produces urine, kidney does all those metabolic work for you, and that is silently happening. Your activity starts when the urine comes into the bladder, and the emptying mechanism of bladder contracting and the passage opening, which is governed by the prostate, is where you involved. And that's a time, if that is amount of time that you involved in and you look at abnormalities developing, which will develop gradually and gracefully with age. Sometimes it can be acute and severe and you seek a help of a urologist. It could sometimes happen post-instrumentation, post-surgery, etc. Then I think it's time for us to look at, not forget our urinary health once and for all. In most mature years of life, while we're all busy with our lifetime, it is important we look into this aspect and probably clear it up. Prostate Cancer Awareness Month, the month of September, is an important month where we come back from Department of Urology again and again to the society, wake them up to this important phenomena that if we probably look at and safeguard our health in time, like the entire health has now come to the front row seat, it will help us out to probably prevent any kind of prostate issues, which could suddenly become an alarming kind of a situation. And remember, the word diagnosis can change our lives. So the very important word of diagnosis can actually be picked up much earlier by a proactive approach with everybody in the society. So all men in their 50s and beyond who go a health checkup, number one, or have complaints and then probably wait around are not doing great. If you have a health checkup, then don't sit over it. Probably get it evaluated by a urologist who will look at the reports on one aspect, because the reports came normal and you're not bothered, but he would evaluate that in the light of not only that worrisome prostatic enlargement, which is seen on ultrasound, but looking at the lower urinary tract. A lot of that function is governed by this test called uroflowmetry, the pattern of your flow. I call uroflowmetry as the ECG of the bladder. That means the way the pattern and the wavelength of the urinary flow, what is left over immediately after that, is actually a great and a best measure compared to a sonography in any other measure. Obviously, it reflects the way you have adjusted yourself to urinary passage, number one. And number two, more than that, it also tells us the reality about changes which have happened. That's something which you can't decode probably completely because you adjusted to it. So in all acute urinary setups where you have got burning sensation, pain, fever, not able to pass urine well, don't empty your bladder completely. You have to go again and again. And the call of nature could be by day, by night, anything which is bothersome in urine. I don't think we'll sit across, take medicines off the counter and probably continue taking it even if you're not doing well. So all patients who probably continue taking medicines for prostatism and still don't do well, and probably are so much reliant that if they miss some medicine for a day or two and are in deep trouble, they all need to see the urologist. In your cities, wherever you live in, a prostate cancer awareness drive in the month of September is a very, very important drive. Remember, you have a day to celebrate, you have a day to mark, but you don't have a month to mark something. So this is something amazing, that Prostate Health Awareness Month, which basically deters you from forgetting your urinary complaints, is an important aspect in your life. I would always suggest that we look into this aspect and continue taking it to very high levels. That's when we would probably have achieved what we wanted to achieve, to probably reach you and reach you better.